Hi, I'm Dr. Chang.
Hello, Dr. Chang. Very nice to meet you.
Nice to meet you. What's your name?
Oleg Gorechenko.
Olga?
Oleg.
Okay,
Oleg
okay, Olga. Why don't you sit down?
Well, thank you very much for seeing me.
Okay, well, you're welcome. So what brought you in today?
Really, for a long time, I had a lot of really bad bowel movements. It's becoming a big problem for me.
Okay.
And lots of pain. But the most thing is that I cannot really do my work. I'm a piano teacher, and I'm losing all the students because I can only work at home now. I have to be close to the bathroom.
What do you mean by big bowel movements?
Loose and many times, and just water.
Okay,
and
so
I have to go immediately. I just have to run.
All right, so have you had this for a long period of time, or how?
Before it was maybe once or twice a month, and now it's every day. In the last 6 months, it's been every day. I went to Russia. I thought maybe the food, the water, the whatever.
I mean, did you do something different? Like, why would it all of a sudden get worse at 6 months? Was that while you were in Russia?
I don't know. But I know that a medicine there really helped me, and I actually brought it with me. I ran out of it, and I was hoping you can renew it for me. It's Margantsovka. It's something we use. I mean, it's been used for years. A few drops. It's a powder. You just mix it. A few drops, and it stops there.
So you got this in Russia?
Yeah, everybody uses it there. And I can tell you, this is what saved me. And I really need it. I hope you can.
Yeah, you know, I can't read this, and I don't know what this is. I'm not going to be able to get it for you here. So we're going to have to just try other things that we have available here. I'm sorry, I'm not going to be able to do that.
It's really, it's not a dangerous medicine. Everybody uses it.
Yeah, it may not be, but it's not available here, so I just can't get that for you.
That's too bad. That's really the only thing that helped me so far.
Well, tell me more about your symptoms.
I don't know what to do with them anymore. I tried some medicines over the counter here. The pharmacist recommended something. I don't remember the name. Nothing helps. And I just run to the bathroom 4, 5, 10 times a day. I mean, I feel like I need to go now.
Do you have any other symptoms? For example, have you lost any weight?
I lost about 8 kilograms, but that's okay.
8 kilograms? Over what period of time?
I can never figure out the pounds, but it's 8 kilos.
Do you think that was because you weren't eating, or that you were just eating and you were still having weight loss?
Well, I wasn't eating in Russia because I didn't feel good, but otherwise I'm eating. And I had some occasional blood.
You had blood in your stool?
Yeah, but I think that's hemorrhoid. I don't know what's in English.
Yeah, because I don't recognize that term.
Hemorrhoid?
Yeah, I don't know what that is. What is that?
It's like on the bottom, the toilet paper.
Oh, so blood on the toilet paper?
Yes.
Okay. So you're having diarrhea and weight loss and also some blood in your stool.
But I don't think the blood is bad because I had this for years. It's on and off.
That might be, but we really want to do more investigation. Get blood tests, check stool, make sure there's no infection. You may very likely need a colonoscopy to investigate that further.
What is that?
Well, that's a procedure where we look and examine your colon just to make sure you don't have cancer, any inflammation that could explain your symptoms. It's something that we would do here.
I don't think so.
Why?
Well, because I had this for a long time. I'm not sure I want to have a lot of tests.
But your symptoms got worse 6 months ago.
Right.
And the evidence here is that when you have those symptoms, a colonoscopy would be indicated, and it's something that we should really consider doing.
I see. Okay, I'll think about it.
You'll think about it?
Yeah.
Okay.
I can do the blood test.
All right. Well, is there anyone in your family that has any symptoms like this?
My sister has some diarrhea, but not as bad.
It's not as bad as yours?
No.
And do you know what she has?
They told her she has irritable bowel, something irritated bowel.
Irritable bowel syndrome, IBS.
Yeah, I think that's what it is.
Well, it's very possible that you have the same thing as your sister.
Yeah, but she's very different. She's stressed. She has this one. She's stressed. I don't have that. So I have a feeling it's not the same.
Well, IBS, you could have that. It runs in families. Some people have different symptoms. Yours are obviously more severe, but you could have IBS.
Dr. Chang, I need you to understand. I had 2 accidents during recital. You know what recital is? All my students that have been training for a year, all playing in front of their parents. I have this beautiful white dress. I'm sitting on the piano stool, and I'm feeling that I'm getting a stain on my thing. And this is, I don't know what to do. I'm only 40. I cannot be sitting at home in the bathroom.
Well, I know your symptoms are worse, and we have to address them. That's why I suggested these tests. I really think you should have. But why don't we do a physical exam? I think we should discuss it further, and then determine what tests you need.
Okay.
Great. Okay. What did you all notice in this communication, specifically around cultural characteristics?
The patient really wanted that drug really bad, almost like if it was like heroin. She needed it.
Right. She brought a medication from her home country, has its own name, it's in a box. There was a lot of investment here, and the doctor just dismissed it.
Yeah, I was going to say, it was just more of no narrative. It was just a sort of sterile, clinical, let me get my questions asked, and answered.
On a one-way street. What else around culture did we notice?
The name again.
Ah, yes. Once again, we had an issue around the name, and once again at the beginning of the interaction, which seemed to again set the tone. Great. I want to check in, Ms. Halpert. How did you feel about your interaction with Dr. Chang?
Well, I was very disappointed about the medicine. I felt that she should be more proactive. I mean, I don't believe that she can figure out what that medicine is. You know, she can look it up on the internet or tell me where to go or something. But this was the reason why I came for the visit. I really wanted this medicine. My primary care doctor said they don't know, so I went to a specialist. That's what I wanted.
Okay. Anything else besides medicine?
She kept asking me to do tests, and I feel like she just was interested in her testing, but not in me.
Ah, interesting. So too much emphasis on tests?
Yes. Lots of testing requests.
Okay.
And she wasn't listening.
And didn't seem to be listening.
Yeah.
Great. Thanks. Dr. Chang, how did you feel about the interaction?
Well, I think that a lot of patients from other countries always bring their medicine and expect us to get it. And if we don't have it, it's really hard and kind of puts pressure on us. And, you know, I mean, I think there's a lot of other treatments that they can use, and they don't have to be fixated on their own medicine. I can't even do this.
Good, okay.
I can't even finish a sentence. I'm so sorry. This is why I don't go into acting.
Sorry, doctor, before I let you off the hook, doctor, just one more question. She seemed to resist tests. What's your feeling on tests and on her resistance?
As a doctor?
As the doctor in this moment. Great.
I think that she needed the test, and she was being stubborn about it, even though there was definitely reasons why you would do that normally. And I was trying to explain it to her.
Yeah, but American doctors just wanted the tests.
Good, and American doctors just wanted to test. Good. So we notice some conflicts based on cultural differences. Let's help out Dr. Chang. Dr. Chang had a relapse. You know, relapses happen. They happen in IBS too. How can we help Dr. Chang this time around? Kind of a last set of suggestions. Sorry, I will. Is this the Russian patient? Is there another page, or is this Russian? So we have the medication issue. That was one thing. There might be a suggestion around that. Again, there might be a suggestion around a lack of empathy. Suggestions around messing up the name. How should the doctor deal with this issue of testing, this conflict around testing, when testing is so important to help with diagnosis, but there's so much resistance on the part of the patient? So just a few good concrete suggestions to help Dr. Chang. Yes.
I was going to say, ask her why she doesn't want the test.
Great. Explore more of the why. Might help break through that moment, that standoff.
And maybe the meds to. It's always hard in the office with a 15, 20, 30-minute visit, but to say maybe I could look into this, see what the American name would be, at least make the effort to make the patient understand that you care. And I think at the end with the patient and the procedure would be, okay, you know, we'll start the non-invasive approach, but if I can't find an answer, we may still have to readdress the procedure issue and then get our next visit or two, if you're willing to do that.
Okay, excellent suggestion. Starting within her comfort level and just acknowledging the possibility that there might be more to come. Other suggestions? We've talked about the medication issue. We've had suggestions for more empathy before, so we should probably renew that call. What about the name? What should she do? I know it's simple, I know it's obvious, but help her out. What should she do with the issue of the name in the beginning?
Get it right.
Get it right. Either get it right, or if you don't know what right is, somehow make it a question. Address it. Honor it. Again, it's someone's name, right? Remember how it feels when people mess up your name or mess up your name twice. How does that feel? And so really honoring a person's name, Dr. Chang. Great. So let's look at this once again. If you'd like to enter again, Ms. Halpert. We're hoping it goes better for you this time.
It's actually Gorochenko.
Ms. Gorochenko, you're right.
Oh, yeah.
It is Ms. Gorochenko. Thank you. I apologize for getting your name wrong. Just want to honor.
Hola. Hello, I'm Dr. Chang.
Ole Gorochenko. Very nice to meet you.
Okay, nice to meet you. Thank you
It's
for
actually
coming in.
Oleana, but Ole.
Okay, that's a pretty name.
Thank you.
So do you want to tell me why you're here and how I can help you?
Well, doctor, lots of pain and diarrhea and, getting to the point that I'm losing my job. I'm a piano player. I teach students in their houses. Now I can only work in my house next to the bathroom. It's very embarrassing. It's devastating. My income is down, and I just need help. I brought this medicine. It's the only thing that helps me. It's from, in Russia, we have this margantsovka.
Okay.
Maybe you can want to look. It's been used forever. Everybody's using it. It's a few little drops. It's a powder. And the diarrhea stops overnight. I mean, it's amazing. And I can't find it anywhere. I hope you can prescribe it.
Okay, so this is for diarrhea that you take and it helps you?
Yes.
Okay. Well, you know what? I'm going to have to take a look at it because I obviously don't recognize it, but
Please.
we have a great pharmacy department that I work with, and we'll investigate this further. So if it's okay if I keep it, and then we'll
please.
see if we can find something like that here.
Thank you. Thank you very much.
Okay. Can you tell me a little bit more about your symptoms? Now, I know they're quite severe, but how long have you had it, and when did it get worse? Could you give me a little more of that?
It's been years, but once or twice a month I had maybe accidents and I dealt with it, and now it's every day in the last 6 months. And it actually got worse after I came back from Russia. I went there just for vacation, didn't really much eat or drink, didn't like the food, something wasn't right. And ever since then, I can't leave the house. It's so horrible. I really need some help.
What are your thoughts about why it would have worsened 6 months ago? Because you've had it for a while. What I'm sure you've given it some thought. What do you think?
I think it was the food. I lost some weight, which I'm happy about actually. Dropped the size. 8
so you
kilos.
actually lost weight?
8 kilos, yeah.
Why do you think you lost weight? Was that because you weren't eating as much, or what was that about? Do you think?
I don't know, but I'm happy about it. I just need something to stop the diarrhea. Even now, I feel like I need to go. It's constant.
It definitely sounds like it has become more severe. But do you have any other symptoms other than, because you have weight loss, you have the diarrhea, and what about any bleeding or blood in your stool?
I have, I don't know what it's in English, hemorrhoids.
Is that, can you describe that for me a little bit?
After I had my daughter, bottom bleeding kind of thing.
Oh, so that's maybe hemorrhoids?
Maybe, hemorrhoids on the toilet.
Yeah, so hemorrhoids is where people can have some of the blood vessels, the veins, just right on the bottom.
I think so, yeah. Must be.
And that can bleed.
Yeah.
So that might be something that you're experiencing.
But I never thought a big deal out of it.
I see. So do you think that's different foods that you've eaten? You mentioned that?
Like what? Upset me. I stopped coffee. I stopped alcohol. I don't drink milk. Nothing helps.
And that hasn't helped you?
No.
Well, I definitely think that It could, I definitely think we need to do more tests. You
What
haven't
kind
had
of
any.
tests?
Well, some of the tests that we do is we try to make sure there's no infection because you traveled outside of the United States 6 months ago, and it may not be. Maybe, you visited the same place you have in Russia.
But what do you think I have?
Well, like I said, I think we need to do a few tests, like a blood test, stool studies, and maybe even a colonoscopy, which is, are you familiar with that procedure?
I don't think so. I had this for a long time. I don't think I need, a lot of a colonoscopy. I mean, I can have the blood test, but I don't see why I should have the colonoscopy. I'll think about it.
Okay. Well, your symptoms are suggestive of irritable bowel syndrome or IBS. And I see that your sister had a history based on the other records that I saw.
My sister's very different. Although she also has diarrhea, it's always when she's stressed, and she has anxiety, and she's very different. I'm calm.
Yeah.
I'm calm, and despite all this, I continue working, and I have it no matter what. So I don't think this is IBS.
Well, it may not be. I think it's something that we have to just think about, just because IBS is one of those conditions where many patients vary. We call it heterogeneous, where patients can have very differing symptoms, but it's still irritable bowel syndrome. So it's still possible. It's very common, but that's something that we should discuss. But let's get back to the tests. So the blood test you said you have in stool studies. So let me just explain the colonoscopy, and then so that you can have more information, so that you think about it. So colonoscopy is usually indicated if somebody has some of these other symptoms, like blood in the stool and weight loss, that's unintentional. And you examine the colon just to make sure there's no inflammation or tumor or anything like that that's causing the symptoms or causing the worsening of the symptoms 6 months ago. So I just want to make sure, just in your best interest, for us to really strongly consider that.
And who will be doing that test?
Well, I can do that. I can do that. So what I think we should do is I'll look into this medication, but in the meantime, let's do a physical exam.
Okay.
Let's discuss again what our plan is and our approach and what treatment we can do for your symptoms, okay?
Thank you, doctor.
Okay.
Great. Let's give him a round of applause. What adjustments did Dr. Chang make?
You used your hands a lot more, you gestured a lot more, you counted on your fingers, you were open.
Right, and I think that gesturing is indicative of kind of care and empathy and a desire to help. So those are manifestations of that, so it's clear that you cared more and were invested more. What else? What other adjustments did she make?
She was more flexible, more easygoing, so let her talk and, interact very well. So.
More easygoing and flexible and opening, and let her express herself. Feel heard. Had her feel heard. What else? What other adjustments did she make? Maybe around some of those issues, testing or...
Well, you explain things better. You amplify the discussion by explaining and giving details.
Adding more information.
And because she kept her medications to do more research about that, makes a big difference in the patient. So the patient can trust immediately that person, that doctor, because said, wow, he's going to take the time to check for me.
Right.
So
even though maybe an inner monologue, distrustful of the medication, definitely wanted to validate her and her investment in that medicines, would look into it, establishes rapport, a point of connection later. Even though there was a disagreement about tests, there was the insertion of more information, breathing through the kind of conflict and kind of using it as a point to, hey, we're working together on this. Wonderful. Let's give them a round of applause.